Welcome back to part 2 of our astigmatism series. If you haven't watched part 1 yet, the link is right down below. Click it and catch up so you have a full ready for today's session. In this video or in this episode, we will take a deeper dive into keratometry and how it works, the key causes of astigmatism, major symptoms to look out for, how astigmatism is diagnosed, treatment options available, and plenty more helpful insights. Whether you are a patient, student, or just curious about eye health, you will find today's discussion packed of valuable information. So stick around. You don't want to mix what is coming next. Think of your cornea as the main camera lens of your eye. It does the heavy lifting when it comes to bending of light and directing it inwards. The lens inside your eye acts like a precision adjuster, fine-tuning the focus so the image lands at the perfectly on the retina. But here's the catch. If either the cornea or the lens has an irregular shape, even slightly light rays won't meet at the right spot on the retina. Instead of a crisp or a clear image, you get a blurred or distorted one. This is the root of many key causes of astigmatism and why the condition comes with classic symptoms like blurred vision, eye strain, headaches, and difficult seeing fine details, especially at night. Now, keratometry is a specialized eye test that measures the curvature of your cornea. That's the clear dome-shaped window at the very front of your eye. Think of the cornea as your eye's main focusing lens, responsible for around 70% of your vision focusing power. By precisely measuring its shape and steepness, keratometry helps eye care professionals understand how well your eye bends light. This is not just important for assessing overall eye health. It's essential for detecting irregularities like astigmatism, fitting contact lens correctly, and planning certain eye surgeries, such as cataract or refractive surgeries. If the cornea's curvature is uneven, light would not focus properly on the retina, leading to a blurred or distorted vision. Keratometry turns this invisible problem into measurable numbers, guiding the right diagnosis and treatment. How does it work? It's like giving your cornea a precise topographic map. The test uses a specialized instrument called a keratometer, or in more advanced cases, a cornea topographer, to measure the surface of your eye with incredible accuracy. This is what happens. The device projects a series of perfectly shaped light rings onto the cornea, and then your cornea reflects these rings back, and the keratometer captures that reflections. By analyzing the spacing and distortion of these reflected rings, the device calculates your radius of curvature, the distance from center of your cornea to its outer outer edges. This is why this matter. Uh, if certain areas appear too steep, it can indicate condition like keratoconus. If areas are too flat, it can affect how your eye focuses light, contributing to vision problems like astigmatism. Diagnosing astigmatism. This is where keratometry steps in by precisely measuring the curvature in multiple directions. It does not just detect the irregularity, it quantifies it. The device can determine how much difference there is between the steepest and flattest meridians of your cornea. There are exact types of astigmatism, whether it's with the rule, against the rule, or oblique. These detailed measurements allow eye specialists to confirm the diagnosis. Then they will decide if corrective lenses are needed and select the most suitable treatment from prescription glasses and contact lenses or surgical options. Think of it as giving your cornea a full high resolution head scan the, that will pinpoint exactly where and how its shape or some part of the shape of your eye is affecting your vision. When it comes to contact lenses fitting, one size definitely does not fit all, especially for those of unique corneal shapes. For people who wear rigid gas permeable, that's the RGP lenses, keratometry is essential for them. These lenses must fit the cornea's surface with precision to provide both comfort and crystal clear vision. Measurements are equally vital for toric contact lenses, which are special designed for astigmatism. Since the toric lenses have different powers in different meridians, they must match the cornea's exact curvature to stay stable on the eye and deliver sharp vision. Keratometry is also needed in cataract surgery or LASIK surgery. The shape of the cornea is carefully assessed by using the keratometer before the procedure. Accurate cornea measurements help the surgeon plan the best approach to ensure the correct lens power that's in cataract surgery and to achieve precise reshaping in LASIK surgery for optimal vision correction. A condition like keratoconus cause the cornea to be thin and bulge into a cone-like shape. This irregular curvature distorts how light enters the eye, often leading to significant astigmatism and blurred vision. So early detection is key. This will slow progression and preserve sight. Keratometry can be used to monitor corneal diseases. It plays a vital role in both detecting and tracking these changes. By regular measuring the cornea's curvature by eye care professionals, it can identify early signs of corneal disease before major vision loss, and it monitor how quickly the condition is progressing. It can also adjust treatment plans, such as custom contact lenses or corneal cross-linking at the right time. Phoropter autorefractor are iconic optical instruments. It is used by eye care professionals. It is used to detect, diagnose, and treat astigmatic errors. The test is very simple. It is non-invasive, and then it is very quick. So, what are the causes of this condition? Astigmatism can develop in many reasons. One, genetics. Others also acquire later in life. In genetics, most people with astigmatism are born with it, and it often runs in the families. If one or two parents have astigmatism, there's a higher chance their children will inherit it. This happens because the cornea shape, which determines how light bends, can be genetically influenced. And then, two, we have eye injuries. Any injury that scratches or leaves scars or distorts the cornea can change its curvature. This distortion in shape affects how light is focused on the retina, resulting in blurred or distorted vision. Even minor injuries can have lasting effects if they alter the corneal surface. Three, eye surgery. Eye surgeries like cataract removal or cornea transplant can restore or improve vision. They may sometimes changes the shape of the cornea. This alteration can lead to post-operative astigmatism that will require corrective lenses or additional treatment. Number four, we have keratoconus. Keratoconus is a progressive eye disorder where the cornea becomes thinner and gradually bulges outwards into a cone shape. This dramatically changes how light enters the eye, often resulting in severe astigmatism. The condition can start in adolescence and worsen over time if untreated. This condition can affect your vision in subtle ways at first, but over time, the signs has become more noticeable. These are some of the things you should look out for. Objects may appear fuzzy, unclear, or stretch, whether they are close or far away. Straight lines can seem wavy or slanted, making reading or recognizing shapes more difficult. Two, after a long hours of reading, working on working on a computer or scrolling on your phone, your eyes might feel tired, heavy, or itchy. This is your eyes working overtime to compensate for the irregular cornea shape. 3. Uh, your brain and your eyes constantly try to sharpen unclear images. This continuous focusing effort can trigger frequent headaches, often around the forehead or the temples. 4. In low light, astigmatism can cause horrors, glare, or poor contrast, making it challenging to drive at night or recognizing faces in dim environments. 5. 5. You may find yourself narrowing your eyelids and attempt to sharpen vision, while squinting can temporarily improve focus. It is a sign your eyes are struggling. Treatment options for astigmatism. Astigmatism does not have to hold you back. There are effective treatments that can sharpen your vision and improve your quality of life. The right choice depends on your eye health, your lifestyle, and your comfort. 1. We have glasses. Special cylindrical lenses in glasses bend light so its focus correctly on your retina, compensating for the irregular cornea shape. Of course, we have clones and cones. For glasses, it's non-invasive and 100% safe. It is easy to use and update prescription, especially in some cases you can update the prescription 2 years time or in some special cases 1 year. It is affordable and accessible. We have some few cones. The glasses can fog up, it can scratch, and then it can break. All depends on how you handle it. And then it reduces peripheral vision as we compare to contact lenses. This type of lenses sit directly on your eye surface for a natural field of vision. Toric contact lenses are special shaped to stay stable and correct astigmatism. Of course, we have pros and cons. Contact lenses, it gives clear vision without the weight of frame and is better in peripheral vision. It gives it is great for sports and active lifestyle. The cons, it requires strict cleaning and hygiene, and it may cause dryness or irritation for some users. 3. There is laser surgery as well. A precise laser reshapes the cornea so light rays can focus perfectly on the retina. 3. If you have been noticing blurred vision, headaches, or eye strain, don't wait. Book an appointment with an eye care professional with the right diagnosis and treatment, whether it's glasses or contact lenses or advanced surgical option. You can regain clear, comfortable vision. Astigmatism does not have to limit you. Yes, thank you so much for watching. If you have found this video helpful, hit the like button. Drop a comment with your own experiences and subscribe for more tips on eye health and vision care. Share this video with friends and families. You never know who might be struggling with these same symptoms.